Today we're talking about the low back and things you can do to help support the musculature around your sacrum, your pelvis, and your spine. So we're covering specific areas in the body that I have found as a sports therapist and structural integration therapist to be significant causes of the back pain. So these are important muscles to target and spend as much time as necessary to get them to open up. Two most important factors that we're going to be talking about today in this video are force and consistency. To get all the structures related to your back pain, your hamstrings, your hips, your obliques, your QL, your psoas, get everything opened up, follow that back line along your spine, give it enough blood flow and stimulus, the tissue will adapt and transform.
Alright, so getting started, we're going to use the linear activator, place it directly onto the extension strap and wrap that around a foam roller. We're going to go up against the wall and lean in. Right above the femur head is your Tensor Fascia Latae, very important muscle. So we're going to start there on the TFL, and you're going to slowly lean in and adjust the pressure as needed, and you're going to activate the musculature doing forward lateral leans and adjust your feet accordingly to get the right amount of stimulus necessary. You can also lift the leg to further activate that muscle. Moving into the glute medius region, we're going to target the base of the spine where your sacrum and your ilium interact with your lumbar spine. So we're going to zero in with some force, trying to find an area that's appropriate, giving yourself a 6 or 7 on the pain scale in terms of stimulus, and then slowly leaning forwards and backwards to activate that musculature. And allow yourself to adapt to this stimulus. This is the beginning phase, so depending on how much intensity and pain you're in, we want to start very slowly and gently. To progress, slightly move the leg medial and laterally to activate the glute medius musculature. Now we're going to target the anterior hip into the hip flexor. Make sure to stay off the medial side of the femur. There's a lot of tendons and nerve bundles in that region, so stay lateral to the femur bone. Next, we're going to use a linear activator against the wall. We're targeting the lateral side of our body, which the internal and external obliques are the area specifically, and then we're moving deeper into the quadratus lumborum region. Moving into the thoracic spine, we're going to show you how to do it with the least amount of force, so leaning up against the wall again, using your feet to adjust the pressure, and using the arms to activate movement under that focal compression. And so find a good spot, lean in, and allow your body to adapt. So you want to be very careful not to place any pressure along the spine, and you also want to be mindful of the SI joint and staying off to the either side of that SI joint. So we're trying to find a good area in the glute medius region and let yourself settle in. That could be another cause of back pain, is some degeneration in the discs or SI joint inflammation. So just be mindful not to put any pressure directly on the spine or the sacrum and ilium. So finishing up on the trapezius and upper neck, we're going to lean in against the wall, apply pressure on a downward force, and then we're going to activate the head, moving laterally, lateral bends using the head to activate that muscle stimulus under that pressure, and using the arm as well to create some activation and movements. Now we want to be very mindful as we progress into the floor version that we're adjusting our pressure and supporting ourselves well with our arm and leg. This is some of the most intense pressure that you've probably experienced, getting into the lateral obliques and QL area. So move slowly, find a good spot to settle into, relax, and then as your body adapts, you can begin activating by moving laterally up and down to create a little bit of a massage stroke and stimulus to that QL oblique region. Next, we're targeting the glute medius region, so find a area that's tender and settle down, relax. Again, we're spending a good amount of time here, 15-20 minutes, whatever it takes to get that muscle to open up. Okay, we're targeting the Tensor Fascia Latae, so begin palpating that area above the head of your femur bone, and this is where the ilium and sacrum, there's a lot of tension on this area, so we're going to try to find a good trigger point, adhesion, hang out, adjust your body weight by supporting yourself with your arm and using your leg and arm to adjust pressure. You can do a little bit of rolling back and forth. We're trying to target and stimulate specific muscle fibers. And we're just going to hang out as long as it takes to get that muscle to relax and soften. Now we're going to be targeting the hip flexor. So it's below the ilium, the crest of the ilium and that hip bone, and staying off the medial side. There's a lot of tendons and nerves. So find your adjustment laterally on that hip flexor region. So the idea is you're looking for a trigger point in that hip flexor. You're going to adjust your pressure appropriately, and it's a very precise stimulus here, and do a little bit of rolling if necessary, but just hang out on that site until that muscle releases. To progress, after we've identified some of the lower back musculature, you can lay down onto the foam roller with the linear activator parallel to your spine, and find a area that's appropriate. You're not wanting anything too intense, nothing above a 6 or 7 on the pain scale, and have your hips tilted anteriorly, and your head should be supported on the foam roller. And then settle in. Be patient with your body. Give yourself a chance to let those muscles relax. They will adapt to this pressure. So we're moving up into the upper shoulder area, staying again lateral to the spine and finding a good spot. A lot of trigger points in this trapezius rhomboid subscap area. So again, find a good spot. You can lay, make sure your head is resting comfortably along the foam roller, and that your hips as well are supported by the foam roller. You can rotate your hips forward with a little bit of an anterior tilt, and that will give you a flat spine in order to adjust pressure, and just you can begin activation using the arm to move forward and backwards, up and down, laterally, and just find an area and a movement that stimulates that pressure and targets the area. So as we're targeting the entire length of the spine here, we want to spend a good amount of time, 15-20 minutes per spot, as we move and really zero in on precise areas and do activation exercises to try to target that musculature and have it move under the pressure. And just know that there's a lot of adaptation that has occurred with postural muscles, and that we need adequate time to stimulate them.
We welcome any questions, info@thestarwrap.com. If you have specific questions and issues, we can also Skype with you. So get back to us, take you to a STARwrap, eliminate pain, get back in the game.